Good morning, everybody. Thank you all for joining us this morning. I would like to just emphasize how critically important this topic of veterans' data privacy is. We need, across various policy areas, we need to be looking at data privacy. As VA continues to grow and expand through innovation and private partnerships, protecting veterans' data from misuse is paramount. And while it is not the main focus of our discussion today, I don't think we can ignore the elephant in the room. Earlier this year, President Trump's Department of Government Efficiency, otherwise known as DOGE, brought the topic of data privacy to the forefront for many of us. Unvetted individuals, the unprecedented access of unvetted individuals to sensitive data left many veterans wondering how they could protect their personal health, disability, and financial information. Although many obituaries have been written about the demise of DOGE, its impacts on VA are still unknown. It's just not very transparent. The situation is not that transparent, that is. Despite numerous requests to the department almost 11 months later, we still don't know the extent to which VA employees and veterans' data was accessed by DOGE, what it was used for, nor have we received assurances that this data was not exfiltrated for private use by DOGE's employees or the tech industry. Back in March, I joined many of my fellow House ranking members in requesting that the Government Accountability Office conduct a review of how federal agencies like VA controlled and monitored DOGE's access to VA systems and data. Unfortunately, VA is not cooperating with the GAO's review and is evading accountability for DOGE's actions at the agency. Now, I have not convened this roundtable to fearmonger, as the Secretary often accuses me and fellow Democrats of doing. Rather, I've called all of you together, all these organizations together, in hopes that the veterans advocates and other individuals who may be watching this will join me in asking questions about how veteran data is being used. I hope you will join me in pushing for better protection of veteran data. I see that the ranking member of the Health Subcommittee has arrived, Julia Brownlee. Thank you, Ms. Brownlee, for joining us this morning. Despite this administration's push to end wokeness, I believe that one of the treasures of VA is the diversity of veteran data and the richness of innovation that comes out of it. There is not another data set like it that is as complete as this whole veteran data set is. The federal government and VA hold a lot of data collected through veterans' military service and medical records, benefits determinations, financial documents, and in some cases, voluntary donations through the Million Veteran Program, DNA samples. This data is meant to be used to create better healthcare opportunities, better services, and better outcomes for veterans. However, the new Mission Genesis project, and under the guise of modernization, this administration seems poised to exponentially expand access to these veteran data sets to private companies and individuals without adequate security, oversight, or accountability measures necessary to protect against misuse. There are numerous instances of consumer data being used to benefit commercial purposes, but I believe the government has an obligation to meet a higher standard, not only in protection of that data, but in informing its citizens about how their data is being used. I wholeheartedly agree that VA needs the latitude to innovate and grow, but advancements in technology should not come at the expense of veteran privacy. There are dedicated VA employees who work every day to ensure privacy laws are followed. However, I'm concerned by Secretary Collins' haphazard approach to quote-unquote right-sizing the VA workforce. These personnel actions have not only exacerbated systemic issues within VA's Office of Information and Technology, impairing efforts to modernize VA systems and undermine VA's capacity to safeguard veterans' data and to respond to evolving threats. Along with these cuts, we're seeing efforts to push veterans' data out the door to contractors and third parties. And when breaches of veterans' data happen, like the Change Healthcare breach in 2024 or the Oracle breach earlier this year, VA denies responsibility, claiming it's no longer federal data. Now, VA should be protecting veterans whenever they seek services, not giving billionaires free rein to commercialize veteran data to shore up their bottom line. Full stop. And while I'm disappointed that VA could not make time to join us for this event, I do call upon the Secretary to perform his duty today by, first and foremost, engaging with veterans in full transparency to educate them on how the department uses data to modernize its service offerings. Modernization must be accompanied by veterans' trust. Second, by barring third-party organizations from taking veteran data, even if it is de-identified outside the federal enclave, and using it to create tools that do not serve VA. And lastly, by rebuilding VA and the federal government's capacity for secure and responsible digital innovation. What does this mean? It means using the tools provided by Congress to hire and retain high-quality technical staff, implementing consistent and enforceable security measures for VA and its partners, and ensuring that veterans' data is not weaponized as they seek care and services at VA. Now, as the capabilities of VA and our adversaries grow exponentially, we cannot afford to allow the protection of veterans' data to become a luxury. It must be a core obligation, a core principle, as long as the Department of Veterans Affairs remains the premier establishment for veterans' care. Again, I want to thank you all for being here. Veterans' data privacy has been a topic that has long held my concern and attention through my entire time here in Congress, and is one that I've been pushing for VA to get right for many years. And while the department declined my invitation to join us today, I'm very heartened by the organizations and advocates in this room who fight for better protection of this data every day. So I'd like for us to go around the room, do very, very brief rounds of introductions. Just your name and organization will suffice. I guess we'll start to my left with Alex. Go ahead, Alex.
Good morning, Alex Rich. I'm the Data Director for Common Defense. We're a grassroots veteran advocacy organization. Good to meet everybody.
Great. Chris?
Good morning. I'm Chris Masinkowitz from the Veterans of Foreign Wars. I'm the Deputy Director of the National Veterans Service.
Great.
Hi, I'm Callie Schrader. I'm the Director of the AI and Human Rights Program at the Electronic Privacy Information Center.
Hi, Cole Lyle, Director of Veterans Affairs and Rehabilitation Division at the American Legion.
Good morning. My name is Jennifer Franks. I serve as the Director of Information Technology and Cybersecurity, as well as the Center for Enhanced Cybersecurity at the Government Accountability Office.
Good morning, I'm Jess Fanukin. I'm the Director of Policy and Advocacy for the Iraq and Afghanistan Veterans of America.
Good morning, I'm Therese Garnier. I'm a veteran and a survivor as well as an author, and I'm with the Black Veterans Project.
Good morning, I'm Christina Caraballo. I'm the Vice President of Informatics at HIMSS, which stands for Healthcare Information Management and Systems Society. Thank you.
Great, great. Well, thank you all for joining us today. As I mentioned in my opening remarks, our session today should be a conversation, and each of you are welcome to speak on any topic we raise today. If you'd like to speak, just take your tent card and put it on the side. My staff will record your interest, and I'll call you in order. Our first, the first topic I'd like to kind of introduce, I'd like to call on Ms. Franks. As I mentioned in my statement, and earlier this year, several House ranking members, including myself, we asked the GAO to conduct a review into DOGE's actions at several federal agencies. Could you share an update on that engagement? Ms. Franks, go ahead.
Yes, good morning. Happy to do so. Much like you mentioned in your opening statements, we did receive your letter and notified VA immediately of the committee's interest in receiving information and doing some data gathering regarding their access, the DOGE access that is, into the VA information systems. To date, they still have been very unresponsive. We have several data calls out. We have communicated with the individuals in all of the departments regarding records and data privacy as well as information technology, but to date, no responses have been given.
And this is, when did this letter,
The letter came in February.
February? So it's not a very transparent situation.
Correct. We thought prior to the shutdown that we were going to get some communication. They told us in October they would start communicating. However, since we've returned to full operations, no communication has been had.
Thank you. Ms. Beard, do you think that, excuse me? Oh, you're not here yet, okay. We'll go to Ms. Garnier. The President has issued a number of executive orders that will limit the data that VA collects and maintains, specifically around race and gender identification. What impact does this have on VA's operations in spaces like research and healthcare? And how does this affect veterans' trust with VA?
Well, we know that there will be some issues that occur with the racial demographics. And so one of the things that could occur, it could reproduce racial disparities with the disability ratings, mental health diagnoses, access to benefits, because these inequities already exist at the VA. It can also undervalue systems more commonly experienced or reported by Black veterans, such as chronic pain or PTSD from military sexual trauma or racial trauma. Also, it prioritizes patterns of care historically given to white veterans, which will lead to skewed risk assessment, triage decisions, and automated denials. It can also misinterpret language patterns, regional dialects, or culturally specific descriptions of symptoms, leading to misclassifications of conversational AI and chatbots. So some of the issues that I've even experienced personally as a advocate for veterans and a veteran myself, I actually posted a video that went viral describing how now the website is requiring us to sign a document stating that they can take all of our information and use it without knowing where this information is going, how it's being used. And what I found most alarming was the fact that law enforcement can take that, the VA can report information to law enforcement and they can use that against veterans as well. So for me, that was one of the most alarming things that appeared when I was doing my own research into this and getting letters from the VA saying that this is what they were requiring, as well as not being able to access their websites or their apps unless we sign a document stating that they now can use our information freely. So those are some of the disparities that I personally experienced as well.
Wow. Ms. Garnier, outside of, separate from VA considerations, I've learned about this phenomenon generally in the population with, say, East Asian women who seem to have this, they can get lung cancer never having smoked. And the conversations I've had with the specialists in the area said, well, this also affects other women of color, actually. It's not just East Asian women, but they're the most dramatic sort of kind of where this shows up. And it just strikes me that that VA and the president are moving away from collecting data based on gender and race. And this is an instance where a very specific segment of the population could be affected. How so? Because if the guidelines say that you only get a screening or a scan if you've been a smoker, but if you haven't been a smoker, you have to, you can see where a test might not be ordered, or the woman in this case would have to pay more for it. This is a situation where, I could see in the VA healthcare system, if the same sort of protocols are observed, certain women aren't going to get, a scan for lung cancer because they haven't smoked, but it shows up in minority women at disproportionate rates. And so this is the concern I have about this idea that we're just, we don't collect data based on gender or race or have these concerns, right? So anyway.
Well, historically, specifically for Black women, a lot of their concerns have been disregarded as far as health care. And so with this going on, now they can determine, so say for instance, I'm a sexual assault survivor, I was assaulted in the military. I am rated for military sexual trauma. They can use their AI and say, this Black woman has been sexually assaulted, but we're gonna remove that from one of the ratings, and then I could lose all of my disability. That's a perfect example of how they can use the AI to track the different ratings, the different health care that we're receiving, and actually weaponize it and use it against us, which is also another concern that I've seen other veterans express to me, and I also personally have felt myself.
Is it Ms. Schroeder?
I just wanted to support exactly what was said here, because this is an issue that we're seeing where the memo that is removing considerations of woke factors really creates a worst of both worlds situation. So we're no longer learning from seeing the patterns that affect specific communities and the trends that affect specific communities. We're not able to track those properly to make sure people are receiving the kind of care we need. However, AI is also taking all of this historic data into it and creating outputs that are perpetuating historic bias completely divorced of context, because AI is not capable of reading context or understanding history that way. So in housing, if AI sees redlining situations, it will replicate that redlining. The AI doesn't know the redlining was based on racial terms. It just sees that historically, these types of names showed up in these neighborhoods. So we'd be recreating the most discriminatory parts of our history or the most unuseful parts of our history as we try to move forward, and completely ignoring all of the very specific needs that communities have.
Well, thank you for that. We've just been joined by the ranking member of our Tech Modernization Subcommittee, Sheila Sherflis McCormick. Welcome, Sheila. Oh, sorry, I didn't see you over there. And the ranking member of our Oversight Investigation Subcommittee, Delia Ramirez. Thank you, Delia. Thank you all for being here. Go ahead, Sheila, go ahead.
I just started, and I really appreciate your statement, because that was some of my concerns, is do you believe that there are actually AI tools of development that can actually look for systematic exclusion, discrimination, because we know it exists, and we do understand in what areas they are. And I've spoken to different companies who said they're building tools. Have you seen those tools? Do those tools really work, or are they telling us that to pacify us?
It may be true that they are building those tools. I have yet to see any that are effectively working and not replicating some of the exact patterns they say that they're trying to address. But that goes both, I think, to the emphasis these companies have on maintaining secrecy and trade secrets as they're building things, and an overall lack of transparency in AI. It's very difficult, even with released AI models, to be able to get insight into the way that they weight their systems or the exact data sets that they get into. So the challenge of examining those systems makes it very hard to verify whether what they're saying is true.
It would be easy for us to create legislation, per se, that actually does an analysis. Like, we're asking for reporting to find it out, so as we can diagnose it, we can really find a solution? Or do you think they would just evade it because it's simpler for them just to continue with their development?
I think that I would never be so brave as to say any regulation is easy to pass, but I do think it's possible to pass regulation that addresses some of those concerns, especially if we're able to craft it in a way that's addressing the harm specifically, rather than going into mandating how a technology has to be built. For tech laws, that's where we get hung up a lot of the time, is trying to mandate specific structures. And technology companies are extremely good at arguing that, well, you don't really understand the terms, you don't really understand the structure, there's a new way we can build this, and so they get around those very easily. But if it's a harms-based message where it's saying we're seeing these particular things continually come up in the technology and there is going to be some liability or some accountability for how that keeps happening, I think that is something that could pass and that would be much harder for them to evade.
Jennifer Franks, go ahead.
I would like to respond as well to your questions and echo what you said. So going back, the technologies have been designed, yes. And every organization can procure the technologies that they need for their specific use cases, for their environment, or that they can design their own. VA has over 200 active use cases using various technologies in various areas, from healthcare to the law enforcement to other forensic and fraud investigations of sorts. And they have explicitly designed, developed, implemented, and tried to start deploying some of those technologies across their environments. However, where they do fall short, as most agencies, is the further implementation of how you're going to incorporate some of your lessons learned. You know, looking at your ethical biases. AI is about code and development and responding to algorithms. And the algorithm is only going to respond to what it was coded to do. So when you gave your example about the redlining, it's a perfect example. If it wasn't trained to understand the redlining, what it even is and how it could impact anyone, if the survivors and their data is being stripped from the information, it's only going to give you the data that it's coded to give. So without having the firm legislation that prevents them from evading some of those technical capabilities as they're designing those tools and then reporting out on those use cases for any potential biases, you do have a lack of transparency. And then there's a lack of accountability for what it is we can hold VA to.
Thank you. Christina Caraballo.
Thank you. I just want to build on if these technologies are here. AI is moving fast, and it's here, and it's only a matter of when it's going to be completely within our systems. It's already being used in some of the larger systems. I think that we really need to focus on this topic because there is a big risk right now of major bad actors coming into play. Not having consent of where your data goes is, it's just heartbreaking. You've got lack of data availability, sensitive data that we've been fighting for to get protections around is imperative. We've been looking, I'm in the health IT universe working on data standards, and we fought for years to get social determinants of health data included in the base level of data that's exchanged throughout this country. And when we started seeing bad actors, we put a big pause on just collecting like maternal health data and very sensitive data because those bad actors could come in, hack our systems, and provide bad care or bad choices to women and vulnerable populations. I think it's really important that we start focusing a lot on privacy and security of the data that is in our systems and the consent. Also, if we want to actually realize the power of artificial intelligence, we cannot continue to have gaps in data and information. Because if we build poor systems, then the output of the intelligence that we have is going to be, we're not going to trust it. And the key is trust. So if we don't have trust frameworks in place where we can actually trust the data and information and the output of the artificial intelligence, then it's meaningless. And we just will not realize this transformational revolution that is happening with artificial intelligence.
So Christina, if you would, I think this, we're trying to keep this recorded so that it's important that our microphones are on. And that privacy is abstract, AI is somewhat abstract. Can you kind of get us more concrete examples of what kinds of things could happen with bad actors? Just because I think the people and the public need to understand what's at stake.
Yeah, so let me give a simple example. I'm one of those advocates that has fought my whole career for access to health information and more data being accessible so that we can do really amazing things with it. And when recent regulations came out, for example, some of the recent regulations just within our health systems on what certified electronic health records need to have in place, social determinants of health and was going to be put on hold where there was a delay. And I said to my team, no, we've got to push this forward. We've been advocating for social determinants of health data to be in our systems. Social determinants of health data, let me give you a concrete example. Things like where I work, where my zip code, I'll actually use that as an example, so rural, underserved areas. Imagine if bad actors started sifting out data, and I heard this was actually happening, where they're looking at your health data, they're hacking into the health data and information that's collected on your address and starting to look at redistricting areas based on that data and information. I do not know if that is true, but this is an example of like a major fear factor that was brought up to my attention. Then I said to myself, oh my goodness, we need to pause because we need to make sure that we're protecting this data and information so that we are very clear what bad actors could do with the data within our health information, and we have to be able to trust that. Imagine the care that patients are not going to get if they're unable to trust that they can use their applications, that they can interact with their health care. They're just gonna turn everything off because they're gonna be scared of those bad actors coming into their communities or into their own health care.
Thank you, thank you. Chris McInowitz?
Yes, thank you. You were mentioning examples of how this could affect veterans and people in general. Well, we have numerous examples at the VFW where veterans have worked with claim sharks, and they signed their contract with them, and then they canceled their contract, started working with us or another service organization, and then all of a sudden they get their claim granted, and they're getting a letter in the mail from this claim shark saying, congratulations, your claim was granted, you owe us X amount of dollars. So our questions are basically, how are they getting this data if, there's privacy laws in effect and whatnot saying that, you're not supposed to access these data unless you have a reason to. Well, these claim sharks are accessing it somehow. We just don't know how. So those data breaches are definitely already there, and we need to make sure that we find them and, close them up before AI exploits them even more.
Thank you. Alex Rich?
All right. So in terms of making things concrete, I think that's sometimes the biggest challenge in this space. I have a PhD in health informatics. I studied public health at Yale. A lot of people use a lot of fancy words, but the most important part of my experience in this zone is that I was a special operations pilot and a crash investigator. And so that's understanding where the rubber meets the road and where the consequences are when something terrible happens, being able to run it back to the root cause and create a policy change that ensures that that tragedy will never occur again is a piece that we're not seeing in health privacy right now. We've known since the early 2000s that as little as your zip code, your gender, and your date of birth can uniquely identify between 67 and 83% of Americans. That's just basic data. But think about when you can blend that with data broker acquired data. It's a study out of Duke University in 2023 that found that running a domain name that was .asia, they were able to purchase military and veteran data from data brokers for as little as 12 cents a record. And that's active duty folks, that's folks who may be serving in high governmental and industry positions. So when you think about these kind of data breaches and these kind of issues, I want you to try to think about, have you ever had to wear a hospital gown? How uncomfortable and exposed you felt? With these kind of data breaches, I want you to imagine wearing that in the downtown main street of the town that you're from. That is how serious this is. This data, when stitched together, can be a threat to national security, it can be a threat to people's safety, it can be a threat to the folks who have already given up so much to our country to protect us. Very important that we keep our eye on the ball here.
Thank you, Alex. I'm going to call on Representative Ramirez and then Representative Brownlee.
Thank you, Ranking Member. I really appreciate you bringing this roundtable together at such a crucial time. Alex, I can't get that image off of my mind. That was just in an ER a couple months ago, so I physically understand. Thank you for that visual, but I think it also just speaks to the urgency of the moment. I think we're all very clear. Congresswoman Brown and I were talking about you need to have the right leadership in order to protect our data, in order to protect our veterans. And I just can't see the words right leadership and Secretary Collins ever go in the same sentence. And we know the number of challenges we have seen, whether it's hiring freezes or mass firings, whether it's reduction in resources, and even unleashing a DOGE army of unqualified workers to steal VA data. We have seen that all happen in the last almost 12 months. And I want to talk specifically about something that within my oversight jurisdiction we have been following very closely. Just last week, we saw a new tactic deployed by Trump and the Secretary. The Guardian reported that the VA plans to create a database of all non-citizens employed by or affiliated with the VA. And you and I both know that nothing good comes up in any collective history that we've seen when institutions are asking that we start creating lists of people. I think, you were just talking about what happens when you're on these lists and the vulnerability that comes from it. The directive to build a list of non-citizens is a page right out of what I believe authoritarian playbook, one meant to stifle political dissent and suppress free speech, with baseless threats to terrorize, to detain, to deport individuals who are already performing critical duties in service of our nation's veterans. In fact, when the VA was actually asked by The Guardian about their plans to share this data with Immigration and Customs Enforcement, ICE, the VA's press secretary, Peter Kasperwick, stated, "The VA will share any adverse findings with the appropriate agencies to ensure that anyone who is not authorized to be in the U.S. is dealt with accordingly." Here's the challenge. You and I both know that that marker of what it means to be authorized to be in this country continues to change with this administration. Doesn't matter if you're a green card holder, if you have the work visa, and you have been contracted by this country to do this work. A non-citizen database is not only a clear overreach, it also raises questions about agencies colluding to abuse data and violate our collective privacy. We're seeing it threaten to leave veterans without access to earn health care and benefits. So I really want to focus my conversation with you today on the impact this policy could have on our veterans themselves. Mr. Beard, I'm glad you came. I'm going to get to you in a second. So I'm going to skip your question and come back to it in a minute. But, let me start by saying VA contractors rely on foreign-born talent at times to perform vital functions that the VA itself is not equipped to provide. So let me ask this question to all of you. Gives them a couple minutes to get settled here. How might a database targeting non-citizen workers affect the VA's ability to recruit foreign-born clinicians and researchers? And anyone that feels comfortable in answering that question, I would really appreciate it.
I'll go. Because I was going to comment on the bad actors and giving you that full example of what the use cases could look like and how AI could impact that data and then navigating to you. So VA has had difficulties for a long time managing the security, data, and privacy controls of their foundational information systems. GAO has inherently reported that they are underperforming in contrast to some of their other federal agencies, where they are literally just defining at the full baseline some of the foundational controls that should be implemented, but they're not taking it to a fully developed and automated status with their environments. So when you're thinking about the payments that could be made and thinking about the bad actors that could impact such a payment and getting that data, infiltrating that information and pretending to be someone that it is not, that veteran then has funds that could not come to them because the system is going to say, you've already received your funds, you've already received your monies. Same way with this new database. If you're building in such a database that identifies certain individuals and can limit some of their controls and their access, any bad actor or even insiders, if you're thinking about insider threat, anyone could misuse that information and then reconfigure it to target them in other types of ways, which could increase malicious activity, whether they are not going to be assigned specific roles and responsibilities within the agency, whether some of their benefits and services are going to be limited. It's going to have a cascading effect. And them building such a database that adds to just the number of other information systems that were poorly designed and implemented, it's just not going to be sustainable for the agency.
And let me ask you a follow-up on that. Not only would it create all sorts of added threats and dangers, what is the impact that it would also have for the VA itself to be able to recruit foreign-born clinicians and researchers, which, to me, talent is global. And we should be actually doing everything we can to be competing rather than oppressing it. So I guess suppressing it. So I guess, Callie, as you're responding, or others, or if you'd like to, how would this actually impact our ability to be able to get these clinicians and researchers?
It's definitely going to limit your
Because they're getting targeted now, right? They're going to be in a list. Yeah.
Absolutely. It's going to limit the talent that you are able to attract. First of all, it's a safety consideration. Why would I want to come work for you if I'm going to be subjected to some of these uncertainties that could then impact my way of life, my personal and my professional environments? So it is going to definitely have some limitations on the talent. It is also going to have some limitations on how then the agency can move forward with their innovations and their emerging technologies if they are not able to retain this talent, get the talent. They're going to have to hire more contractors. And the contractors could be subjected to some of the same scrutinies if they are not naturalized citizens.
Thank you. Did anyone else want to answer? I just have one more question, but when did you want to add to it?
I wanted to add about the concerns that occur. I want to give you an example with the VA with Secure Messenger. One of the points that they had made is it's called Secure Messenger, which is what you use to contact your doctor to say, hey, I need an appointment for said things. I've recently realized that they now say don't send personal information because it's not secure. The program's called Secure Messenger. So now I'm seeing reports of different people being concerned to even contact their doctors, to make doctor's appointments via Secure Messenger because their information, they don't know where it's going. I personally have experienced that as well, and it's made me hesitant to even want to disclose or make appointments, and that's predominantly the fastest way to get an appointment now at this point. Calling, they rarely answer their phones. And so bad actors could be potentially taking that information. We don't know because they said that it's not secure, it could be going anywhere. To piggyback off of, I've been seeing reports of service members and veterans who, and I don't know if this database has been created yet, but someone's getting the information because I'm seeing reports of their spouses being arrested by ICE. So where are they getting this information? And the people that I spoke to in the reports I'm seeing, they believe that they got the information from the VA, that they have a spouse that's, that ICE should look into and target. And so that's another concern I think a lot of veterans and service members have in regards to where their information is going and how it's being used.
Yeah, thank you. Callie, maybe as you're answering, because I know I'm running out of time, I wanted to just ask an extended question that maybe Callie, you and Mr. Beard can answer, but a lot of the conversations that I'm having with stakeholder groups and veterans, one of the prevailing issues that they keep bringing up is the challenges that veterans are facing accessing their benefits once they're not in the U.S. So I guess, and this was a question I was going to ask Mr. Beard, but Callie, please also feel free to answer or add to what has already been mentioned. Could collecting data on non-citizen VA employees or contractors affect veterans receiving care through the Foreign Medical Program or at any of the overseas clinics? Either, and then if you want to go ahead and close this, thank you.
Yeah, so I kind of want to circle back to the earlier conversation, and I think they're very linked. Whenever we talk about collecting information on individuals or entities of any kind, there are good uses for information, and then there are nefarious uses for that information. Again, when information is collected, it becomes a very attractive target for those that would do us harm as a nation or to individuals. but it also has utility for the citizen. So I think it's very important to understand many of the laws already on the books are very specific. You shall gather this information and use it only for these purposes. Any attempt by any organization, to gather information without a safeguard like that, use it only for the betterment of the individual, the citizen, or for a very narrow purpose for the state, opens the door for misuse. And I think the challenge is also putting in place effective penalties, because I know from being inside the VA, if there was no penalty, if no one was going to go to jail or there was no thing against it, there was an assumption of permission to do, which is great. And can be very helpful, but it can also be used, as we have seen, I think, to drive a freight train through that is harmful to citizens. So again, that any gathering of information, there's lots of protections already on the books for any system of record to have a reason for being created and to gather, and it should have a specific purpose and not deviate from that purpose. I think you, the members, have a great opportunity to be very clear in language in legislation to specify the purpose that information should be used for, and it should be for the benefit of the citizen, and then for the very limited reasons it's useful for the state.
Ms. Brownlee, go ahead.
Thank you, Mr. Chairman, and by the way, happy birthday.
Oh, thank you, thank you, thank you. Medicare. But I'm not taking it for other reasons, but whatever.
So I wanted to hear a little bit from the veteran organizations to the degree that you believe the average veteran has any awareness of their lack of security, if you will, around their own individual data. And, that leads into a question of, if they don't have much awareness, how do we make them aware so at least they're able to advocate for themselves?
Yeah, thank you, Ranking Member Brownlee. It's a great question, because when he said assumption of permission, that was my first thought was, there was a focus group that was done, I think of 75 veterans, that said 71% generally are okay with the use of AI in healthcare benefits. The legacy organizations, it's no secret, they're a little bit older, right? I'm 36 years old myself, and I don't understand all the nuance. I'm certainly not the smartest person in the room on this issue. So I think it's incredibly important that organizations like the American Legion, we conduct oversight trips, system worth saving, regional office action reviews, where we go and talk to, on regional offices, VSRs, RVSRs, and at system worth saving visits, healthcare providers, and talk about how this issue is being used in a very direct, real sense. A lot of veterans just don't understand specifically unless they're told. So one of the concerns that we have as an organization with the accelerated rollout of the electronic health record deployment next year, and the protections that veterans have in terms of, not protections, but the awareness that veterans have of use of AI as these systems are rolled out, because the scale is the VA's biggest weakness on veteran data. So if you're accelerating something, you just need to make sure that veterans are aware of when that's happening and make sure that they're okay with it. Right now, I think it's the assumption that most veterans are rolling with and why they're okay with it.
Thanks. And can I ask another question?
Please, go ahead.
So, Ms. Franks, you talked in your opening comments, I think you spoke about hundreds of AI applications going on within the VA. So I've been on the VA committee now for 13 years, and one of my biggest beefs is that the VA is the largest healthcare enterprise in our country. It is, of all government agencies, it is the most customer-oriented agency, and yet when it comes to technology, it seems as though the VA lags way behind
not only other departments within the federal government, but certainly compared to private industry, private healthcare delivery systems. So, I think the VA, because of its size, has a database that is invaluable to research and so forth. It's also, I think, very vulnerable to nefarious kinds of various kinds of actions. So I guess my question really is, how does the VA do better at all of this? And, you even said that in terms of security, that other departments within the federal government are doing better than the VA. So if that's possible, that other agencies can do better, what's wrong with the VA? And because we are a customer-oriented agency, we should be the best, not the worst. And so I just don't know, how do we get there? Every time we initiate a new bill, a new law, a new program, the VA always says, well, we have to have a system to support it, and it's always delayed 2, 3, 4, 5, 6 electronic health records. It goes on like that, and we say, well, let's buy systems off the shelf. That doesn't seem to necessarily work all the time. So tell me how the VA can do better. What is the structure that needs to be in place to do better?
So good question, and thank you for that. It starts at the top. There is a lot of organizational change that consistently happens at the VA, and it is a detriment to the organization. The decentralization of VA and how it is spread out across the states, and even globally when we travel, the veterans who need care, the information still has to go back to the headquarters agency, and they're not managing the safety of their security controls across their inventory appropriately. One of the biggest findings we found in every single agency is a lack of management around your hardware and your software inventory. You cannot protect what you don't know you have in your environment. And because their inventory is so vast, the answer to your question about just let us create a new database, you need to go assess what you already have and perhaps streamline some of the resources in your already established, already approved and authoritative systems to really provide the information that you're looking for. The culture is really preventing them from moving forward with some of those security models. The frequent changes of this chief information officer, the risk officers, the financial officers, the chief cyber security environments. You have to have some type of stability in your environment to really ensure that some of those efforts are going to continually help to build your programs. Some of the agencies that are doing better, and I will say for the record, VA is not the worst, they're just among the worst. There are several agencies that are right down there with them, but there are several agencies that are doing relatively well. And the majority of them are a little smaller, right? They're not as decentralized, and the community and the culture has been built to where the agency can talk through the tech and the emergence of the technologies and how we actually need to develop more security controls around the programs to then be able to manage this data better, communicate to our customers that their information is being used in this way, their information potentially has been compromised. We were talking about, he mentioned the don't understand unless told, but then what do you do with that? How are we educating the veterans and the other service members about their information that has been compromised? So having a lack of those types of controls in that environment is really part of what's preventing them from moving forward, where other agencies, such as the Small Business Administration, they can communicate in their environment because it's just a little bit more refined.
When you talk about culture, though, do you mean culture, not lack of knowledge culture, or are you talking about some other culture?
Correct, not lack of knowledge, because well, maybe not now. There has been a lot of change at the VA, as Ranking Member Takano's opening remarks indicated. There's been change every single day. This calendar year, where people are no longer there. So that knowledge foundation is leaving the department at a rapid speed. But the culture I'm speaking about is the organizational management of how decisions are made, how the hierarchy of who does what, how they do it, how they communicate it, what's procured, what's not, how the decisions are just really informed to impact the agency and its community.
Thank you.
You're welcome.
Thank you.
I just want to acknowledge we have Nikki Bazinski, who actually is the ranking member on tech modernization. I misidentified that ranking member slot to Sheila. But Nikki, you want to ask a question?
Yeah, thank you. I was chomping at the bit to jump in, but it's great to be with everybody here today for this truly, really important conversation. I think just adding on to what you were talking about and the question from Congresswoman Brownlee, you know, it's been very disturbing to me, some of these changes. And what I specifically mean is we still at the VA been raising concerns around the fact that we don't have a CIO at the VA right now. We've just been told that the DepSec is now filling in as the CIO. So when we talk about how we're trying to improve services and elevate the VA from the bottom, first of all, get a CIO confirmed by the Senate seems pretty obvious. But I am really concerned by that. I'm also really concerned by the additional pressures and programmatic expediting of EHRM, which is obviously a very big focus of the Tech Modernization Committee, that the president's budget cut OIT by $500 million, and they're asking them to do more. So that's very troubling. So I guess before I have other questions too, but I'd love to hear from you, Ms. Franks, and Mr. Beard as well in particular on that, the importance of, you said at the beginning, leadership matters. When you don't have a leader at the top, what does that mean for implementation of these really important modernization efforts for our veterans?
I would agree. And then not having a leader at the top and having a constant change of the leader in that position limits your ability to implement some of those outstanding recommendations. So GAO, of course, I go back to my earlier comments with the work that we've done evaluating the information systems and the security and the privacy controls around that protection of data. We have seen from time and time again some of the concerns stem from the management or the lack of management of OIT. And with the reduction of their workforce, with no workforce contingency plan, with a clear timeline of how we can fill in the gap, there is not a clear indication of when we can actually advance some of those recommendations to implement, which would then limit some of the potential biases with the AI use cases or the malicious actors of sorts. There, 500 million is a significant baseline, and what we've also reported out in our reports is, I mean, everyone always comments on not having enough financial resources, but to even reduce it to such a vast number, you're going to have to lose something. So understanding the risk to your agency, the risk to the veterans and what that looks like is not very clear if we do not have a leader in that position to communicate.
Yeah. Would you like to add anything, Mr. Beard?
Quite a bit. I'll try to limit my comments. I absolutely agree with Ms. Franks. Leadership is super important, especially in an era of reduced resourcing. You must ruthlessly prioritize. And VA's primary priority is to ensure services to veterans at medical centers and cemeteries and benefits offices are uninterrupted. So the staff, about 3,000 staff that are required to keep everything that is out there, 2 million pieces of equipment working, and that's a significant part of the budget. Then there's actual modernization of systems. That's a significant part of the budget too. Again, much conversation about how old the systems are. And VA's been on a good trajectory to get rid of technology debt and build new platforms that are extensible, so you don't have to rip and replace every time there's a security threat or a new technology hits the ground. But that requires persistent focus and vision over a number of years. And this administration has not been particularly consistent at that vision. And again, significant turnover in leadership among the senior executive ranks, security teams, lots of legacy folks that knew all about how the systems worked and had been working just for the good of the cause and the veterans, chose to retire when there was a hostility towards the federal workforce and a lot of chaos in the culture of federal service generally. We're not immune as servants of the public. When that culture change occurs, it makes it difficult for us to choose public service. I was lucky I was at the end of my 30 years and I could retire. But many of my colleagues have been like, well, this is just too difficult to keep focus every day when the leaders change, when the priority of the day changes, and when the resources ever shrink. It just becomes very difficult for teams. So I think you're both right.
Yeah.
Yeah, exactly. Didn't need
ask you too, because we've
explain
spent
that at all. Yes.
We've spent some time talking to GAO, and the real threats around cybersecurity and the vulnerabilities within the VA also is something that's really very concerning and only becomes even more concerning when you're talking about this lack of leadership. Is there anything you could add or highlight specifically around concerns with cybersecurity, given the comments that you've made?
Oh, I was just going to say, well, tomorrow's my birthday, and I have a new VA report coming out.
Happy birthday.
Thank you. And there's a new VA report coming out that looks at some of those cybersecurity assessments and risk that we have been talking through, starting at the foundation of their information systems. The policies and procedures are just not established well enough to even define the what is and how you should conduct this business. Looking at some of the configurations of the systems. You were just mentioning that the DevSecOps lead is now serving as an acting CIO. No, we need that DevSecOps lead to be refining the foundation of the configurations of the infrastructure so that we can accelerate with some of the foundational security controls that are just not in place. We need to be looking at the ICANN policies, looking at your identity and credential and access management. Who is able to access these systems? And once they're accessing it, if they do not have a need to know, what are they doing with this data? How is it being used? And just in other areas as well, user access and authorization, contingency planning, incident response. So we want to look at some of those controls, and that's what the assessment tomorrow is going to take a look at. It was an assessment that was originally contracted to be done by MITRE as an independent assessor, and then we came in to provide our overall evaluation of the assessment and some of the recommendations that VA received. They received a couple hundred recommendations, but because of the lack of the workforce, we've been a little delayed in working with them in implementing some of these very, very timely recommendations that would just help secure some of that data.
Working on policy is not going to help us operationally secure veteran data. So what's important in a time when we have less staff is to use the automated tools. There are some great automated tools out there that are being used in private industry that the VA has been slow to adopt, again, because they've been stuck in some churn. Security threats and vulnerabilities, being able to automatically check the systems, their configurations, make sure they comply with baselines, check for threats, automatically inventory all the libraries and the software repositories, and then check for new vulnerabilities that come out, even in our supply chain. That's what we need to do, is get those automated tools in place in the VA. Running around working on making sure your policy documents are in place doesn't help nearly as much as making sure that we're locked down and we know every change and every vulnerability, and we're working hard to protect them. So focusing VA's attention on getting those automated security tools in place, whether it's around identity, credential, and access management, database monitoring and control, event monitoring and control, advanced threat security, that's really important. So I think that's very important.
Congressman, it just strikes me, if we haven't already done so, we should probably get a letter.
Okay, yeah.
Go ahead.
I just had one more.
Continue,
Okay.
please, go ahead.
Now that I have you.
No, continue.
That's okay. But yeah, definitely would love to do that. The other thing, just on picking up on what you're saying with data privacy, is it is really concerning. The VA's chief technology officer, currently, I've heard that there is no consent or opt-in process for the use of AI in benefits determinations or medical assessments now. At the end of September, the VHA updated its in its notice of privacy practices to inform veterans about its new AI policies, and I quote, "We may use or disclose your health information without your authorization." is just very troubling, because as we looked at the policy, it's not, I don't see that there's an opt-out process even for a veteran. So I'm just curious if you're tracking this, and this is my last question, if you're tracking this, what you think this means, what we can do to protect our veterans so they can protect their own personal data as it relates to their health.
Happy to get a letter
Yeah.
and start some new work at the VA. They're likely not going to be my biggest fans, though. But are we tracking? Yes. So VA isn't the only agency, obviously, that has established or reestablished some of the privacy policies. But the difference is you must have an opt-in or an opt-out. At the very least, they could have sent the information out and said, this is what we're going to do, this is how we're going to share it, this is how we need the data to train the AI models in this way. The data will be utilized here. It will not be sold, or it will be sold. You mentioned law enforcement earlier. We need to know how the data could be utilized and to what length. How much of your data? Is it just your personally identifiable information? Is it your healthcare information? Is it your gender and some other biases? And give you the opportunity to opt out. Same way you would use an open AI source like a ChatGPT. You can turn off certain features so that it's not, continuing to maintain your very sensitive data. So you must have one or the other, an opt-in or an opt-out, but they are using it to train their algorithms.
Well, thank you. Sheila McCormick has to, Sheriff McCormick has to leave soon, so I want to make sure she had a chance to get her questions in.
Thank you so much for accommodating me. I have to go to another committee. But I wanted to touch on what you were talking about, and I thank you so much, Ranking Member, for the technology and modernization questions. As of right now, the technology and modernization reauthorization is not in the NDAA. And so by the end of this week, if it's not in there, that's going to be freezing $160 million in funding. And it seems like this stop and go that we're seeing in the VA is really due because of the funding stops and goes and freezing. So could we anticipate any problems, in the near future because of that funding pause? And are there funding within that are projects that are being used currently and that rely on that?
Currently part of VA, I can't answer directly about any particular project. I can tell you historically when there have been lapses in appropriation or gaps, the priority has always been ensuring operational contingency. So to make sure that the lights stay on and things continue. All new work, projects sort of in flight get paused or slowed down significantly. So again, instability, this has been a challenge at VA for the IT appropriation for a long period of time. Without an advanced appropriation, every September 30th comes with anxiety in the IT department at VA, because you never know if you're gonna be able to continue projects or start a new project that you wanted to do to help make things better. So getting more advanced appropriations, more stability in VA IT appropriated funds year over year really helps. And I know special purpose funds have always been an exciting tool used by this body and used effectively. But those special purpose funds can dry up, and that makes it very hard to plan for a long period of time. So all of that leads to risk and uncertainty. In the face of uncertainty, leaders tend to get incredibly conservative.
Well, thank you. I'm enormously impressed by member interest in this topic. I want to acknowledge the presence of, Dr. Herb Conaway. Thank you, Herb, for being here. Yes, ma'am. Yes, I'm going to be calling on folks. I want to get members their questions in. That was my intent. I know that some folks were waiting very patiently. I have you on a list. Ms. Finucane, you had a comment earlier, and I hope you remember what it was. Yeah.
Hi, good morning, thank you. I am by no means an IT or data privacy expert at all, but as a new veteran myself, I just wanted to speak to the veteran experience and highlight a couple of bigger picture messages. So first, just want to highlight the post 9/11 generation. While we may be the most digitally literate, we also have the biggest digital footprint that all of, or almost all, depending on when you came in, all of our records, all of our entire history is going to be online in databases. So while AI and technology is increasing at a rapid pace. Just keep in mind, it's such a critical time now, especially for our generation, we are going to be the most vulnerable just by how much data there is, all of it online. To Congresswoman Brownlee's question, you asked about what the general sense of what veterans do or don't know, and we don't have at IAVA any particular data on data privacy from our members currently. That's something definitely moving forward in our member surveys we can focus on and ask. But again, as a veteran myself, I'll say there is, as Cole mentioned, an assumption of security. I don't know what I don't know. And so if I was not in this space, I'd have complete faith in the security of VA. Going through my claim right now, I have 30-something pages of uploads, medical records, all sorts of identifiable information, and I'm terrified that that's all out there, right? But if I didn't know that, I would not know. And so how do we get that message out? Y'all just spoke to the opt-in, opt-out. I think really something that needs to be done now is the explicit, transparent explanation of how our data is being used and a meaningful opt-out. Even if an opt-out pops up right now, I wouldn't even know what I'm opting out of or how they're using it currently. So I think that's very important and critical. The second point is a little bit of a side quest, but I think Rep. Ramirez brought up a good point about the non-citizens list at the VA. Just want to highlight with the national security implications of everything that's going on in the world right now. So we have the immigration process being paused for certain communities. We have folks that we want to retain and recruit that are going to be placed on a non-citizen list. That is highlighted. We are highlighting on a world stage right now that we're not good or reliable partners. So that is, to me, a national security risk, not just veteran data privacy. So that's just bigger, broader implications. Thank you.
Thank you. Thank you very much for that. Therese Garnier.
Yes, sir, thank you. So I want to piggyback off of what Jennifer and Jess had said as well. I think what Congress should require, they should have a veteran data bill of rights. And if we have that, what it can guarantee is data minimization, no secondary use without consent, like they were saying, a clear opt-out pathway, and also have transparency when AI is being used, especially when it's a decision that's going to impact the veteran. Also making sure that we have a human safeguard. So AI cannot issue final decisions on like disability claims, discharges, or mental health risks, right? So if we have human reviewers, they can always override what the algorithms are saying and hopefully have their own input. And then lastly, what Congress should definitely ensure is that we protect whistleblowers. So if any VA employees or veterans come forward, they can report that AI is being misused and not face any sort of retaliation.
Go ahead.
I just want to mention, because you said, talking about a bill around preventing veterans from their data being used for secondary sources. I'm working on legislation right now that would be a data privacy bill on specifically that, protecting veterans from that, but also the monetization of their data as well, and protecting veterans that might be vulnerable to their data being used for profit. So would love feedback from everyone as we're putting that together. Thanks, Mark.
Thank you. I'm just very impressed with, our members' concern, and this has long been something on my mind, this whole area, and I just love that we have different members with different teams of people who are putting their intellectual assets into this topic. So this is, I think, so important. Callie Schroeder, I wanted to call on you earlier, and I want to actually kind of include Ms. Caraballo, but respond to whatever you were going to respond to. But I would like to bring you back to how your organizations define informed consent. We've been touching on this with your questions, Nikki, especially as we need to balance the need for modernization and innovation against concepts of data privacy and freedom. So if you two can both comment on how your organizations approach this, and then whatever else you had to say in response to what was going on here.
Sorry. Yeah, very happy to address that. So for some small background, we focus very much on privacy issues at the Electronic Privacy Information Center. Prior to working there, I used to work at law firms doing international compliance with privacy. So I've tracked a lot of different consent models and what's required there, particularly for sensitive information like health information. And what I worry about in framing this as a consent model is that a lot of the conversation around AI use and modernization and supplying benefits, it emphasizes the need for data in ways that can feel almost manipulative to people or coercive to get them to consent. So if you're saying to someone, we really need your health information so that we can build a system that helps veterans, people are going to feel a kind of camaraderie and motivation to want to say yes to that because they care about that issue. But asking for that consent doesn't guarantee that their information stays safe. We've seen so many examples of AI systems that have had security breaches because of like prompting that reveals raw data sets. Back when I was doing compliance work, one of the things that I did is when there was a data breach, I would look over the anonymized or de-identified data to see if we needed to report to an attorney general there was a breach. It never took me longer than an hour on Google to identify a person with the pieces of data that were in those data sets. De-identified does not mean that you can't identify individuals and pull lots of inferences from them, and that is so much more true when you're using automated systems and combining multiple data sets. So I would really urge people that informed consent can be a standard that's used for using information. I absolutely prefer that to just saying, well, we need it for research purposes, so we're taking it. Anytime that you're giving people more control and a little more dignity over their data, that is a good thing. But for it to be informed consent, you do have to be very clear about these are the protections in place, these are the exact organizations or individuals that will have access to that information. This is how we're going to be protecting you, and if this goes wrong, here is the recourse for it, and here's how we're going to defend you in the event that there's a problem. So all of that, I think, does need to be a factor when we come to informed consent in this way. And frankly, I mean, I'm obviously on the much more privacy protective side of things. I cannot think of any justification for using veterans' data and selling it in data sets to AI companies, and that has been a proposal we've seen with DOGE's use of data across the government, that there's so much value in all of this information, and wouldn't it be great to sell it to companies to use to develop their models? And I really, really would say that just cannot happen here. And tied into that, the final thing I'll say is the larger point I was going to mention earlier is just that the administration is pushing really hard for AI development and modernization, but the framing of those conversations is around how can we find uses for AI because it is de facto this revolutionary technology. That's the wrong framing. We don't need to adapt our systems and our society to fit AI uses. We need to see how AI is actually useful for individuals because that's who we're serving here. And I think making sure we maintain that focus is critical in establishing AI systems that function the way we need them to and that achieve the goals we're looking for.
Wow.
Just one quick follow-up to what she's saying. So is there any kind of, I guess, forensic model that could look at various data sets to determine whether our data sets have been sold to other entities to be able to determine that?
Defer a bit more to the technologists here just because I've looked at some of those systems and I have certainly heard some proposals for that. I haven't been able to test them myself and see what the accuracy of that is, but I do know there are existing proposals for forensic technologies that can do that.
Go ahead, Mr. Conaway.
You know, the informed consent, we see it in healthcare all the time and other aspects of life as well. Those documents, those consents can be so dense that people simply don't read them. And they're not often in sort of a plain language that will point out, you know, the big things that people are really going to use to base a decision on whether or not to share their data. And so I don't know, as you have looked at these various consent documents, whether you've looked and focused on that, and is there, can I say, a sort of a right way to actually do informed consent in a way that actually informs the reader so that they can protect his or her data?
Absolutely. So for best practices, when we were doing informed consent, particularly for health information, because it's so critical, you really need to understand what the risks are and where it all goes. We would take much more time with it than we would with like your standard internet informed consent where you're clicking a box somewhere. So you would have long systems that are listing all of the uses, but we would have like bolded headings that are saying, this is the type of information we're discussing in this section. And it must be in plain understandable text for people. It's very easy with both technology and health to get so hung up in jargon that it's effectively a way to mask what you're talking about. And people would argue that we're just being very precise and we're making sure we're giving all the disclosures, but we know that's not what they're actually doing. They're trying to make it non-understandable at that point, and just kind of banking on the idea that you trust the organization offering it, or you trust whoever's asking you to sign the form enough that you'll kind of ignore that you don't get what it's saying and just move forward. So for health information, I would say if there's any possible way to have a system where there are clearly highlighted things that summarize the different issue areas so they can dive into the details if they want, but they're able to get the larger picture from those bolded headings. If there's someone available they can consult with to say, hey, I don't understand this section, what does this mean? That is a really critical, I think, amount of accountability that's necessary as well. And also the option to revoke consent. If I sign a form and then later I find out there was something in there I missed or something that really concerns me, there should be the ability to have easy access to someone that you can say, hey, I take that back, please remove all of my information.
And I wonder, as a workaround or a signal to the reader, that an organization can be described as trusted or not. So if someone comes and says they have my data, trust me, and it's shown through other means that they are not trustworthy, then perhaps we don't even get past the preamble to that consent. I'm not going to trust you with my data. And so I don't know if there's an organization or process whereby those data houses or other gatherers of information and storers of information, whether or not there can be a stamp placed on them that, this is an organization that hasn't had breaches. We haven't discovered that they have, sold your data. So they are trusted as a signal as people review these documents that, I'll let them proceed along these lines. But if they don't have that stamp, well, then I'm out, and we'll take our business elsewhere, or have a relationship with some other organization that is trusted. Have you seen that kind of a system used in this space?
In certain industries, definitely. There are systems in place for like independent auditors of systems, and you can get trust seals, and you have to go through a very rigorous process to ensure that everything's been examined. So in high-profile industries in general, in some security settings, definitely, and I would imagine in the medical field as well, particularly when it comes to medical devices, but I'll defer to Christina there as being a little more expert in health data specifics. But the potential for having a trust system like that is definitely there, and I think would be fairly, not easy, but you could be able to make a very compelling argument for establishing it in this case because it's been built up in other industries. So we at least have a blueprint we could build off of.
So we're running close to time. So here's what I propose to do. I wanted to get to Christina, and then Therese, and then maybe offer the VSOs the last word. Christina, why don't you? Was interested in your organization's definition of informed consent. I mean, I was really struck with Kali and her comment about how consent is a very limiting concept in this case, maybe the wrong frame, but go ahead.
Yeah, I want to build on the trust. So I think consent's important, but if we don't trust where our data is going and how it's being used, we're all going to opt out. And if we want to actually modernize our healthcare systems and realize the power of artificial intelligence, AI is going to fill in the gaps. And if we have bad data going in, it's bad data coming out. So we have to not only think about consent, but we have to think about trust so that people do consent to share their health data so that we can get information and act on that information to make informed decisions. From HIM's perspective, I think it's really important and just from what we're trying to do to ensure veterans have a very clear and have enforceable protections for their sensitive and personal health data, whether that data is being used by the department, a private provider, or a contractor. AI advances promise clinical operation and administrative benefits, but those benefits must not come at the cost of veterans' privacy. When thoughtfully applied, AI can help streamline administrative burdens, surface clinical insights for faster and improved overall experience for veterans navigating their healthcare. However, our existing frameworks and requirements set by the federal government do not adequately address risks related to data privacy, security, and appropriate use, especially in the evolving nature of AI. The rapid growth of AI across federal agencies means VA must ensure that any use of veterans' data for model development is governed by clear and transparent safeguards. As the VA explores AI-enabled tools and workflows, strong data governance, modernized acquisition practices, and consistent oversight are essential for maintaining veterans' trust and protecting sensitive data. And again, ensuring that data and our veterans can actually trust the systems that they are using is essential, regardless of consent. Because our goal is for people to consent to use the tools that they have, to consent to engage with their healthcare, to consent to give to data banks so that we can actually start acting on getting research and make better clinical decisions. When we're thinking about AI, I also want to leave everyone with the thought. At HIMSS, we've been thinking a lot about how to navigate artificial intelligence. We need to think of 3 buckets. It's not just AI in one bucket, and there are risks associated with those buckets that are greater or less. When we think of AI, I think of the 3 buckets are clinical, administration, and operational. Operational, administrative, those are easy, low risk. When we think of AI in clinical, that's when we have to really think about the safeguards that are in place so that we can build a trusted ecosystem and create the frameworks that are going to allow us to really modernize our health system. Thank you.
Thank you. Thank you, Christina. This is a very thought-provoking conversation. Teres.
So I think it's important with building trust and making sure that veterans can consent to the information is making it understandable. So I had mentioned earlier, I produced a video, it was about a 1-minute video that I shared on social media explaining what the VA was doing with our information. I had hundreds of people reach out to me. I think that video is at 200,000 views and comments from individuals saying, I didn't understand what that meant, really asking me to explain it to them more. And I think that's what's so important is making this digestible, making it at a 5th grade reading level and explaining this information to them because just like they stated, I didn't understand what they were saying when it told me to click that, and people are so desensitized to getting these alerts that pop up and say, just click this, you can move on. They just go on ahead and click it. So I think that will help build trust if we can use tools like social media, creating 1-minute clips that can go on Instagram, TikTok, the different platforms, showcasing what the AI is being used, how it's impacting veterans, and in that way it kind of simplifies it so that way they understand it. Especially for those in my generation as well. So I just wanted to bring that up because I think that'll be very important for building that trust with veterans.
Okay. Any VSO comments at this point? Go ahead, Mr. Lyle.
Thank you, Ranking Member Takano. We were talking a lot about healthcare, and there are some exciting innovations where AI is concerned in healthcare, and we're talking about trust and informed consent. I not so recently saw a demonstration of Oracle's AI technology to help with auto-generated notes and evidence-based recommendations where there's still a VA provider kind of on the loop making those decisions about recommendations, so it wasn't AI making the decision itself, obviously. And that can cut the amount of time providers spend on administrative tasks so they could see more veterans. So there are benefits to this. One of the things that I wanted to bring up, we've talked a lot about healthcare, but in the benefits process in the American Legion, service officers last year did $21 billion in disability compensation assistance. This year we hit that number by August. which is a new record. When the administration came out earlier this year and said we've done 2 million, we've reduced the backlog by 2 million, 2.5 million, I didn't see a noticeable difference in the appeals number. And I was a little curious about why that was. So on the ground, we went to the Chicago RO, and a lot of the answers we got were automation of presumptive conditions where RVSRs and VSRs were seeing some of these claims companies and these medical feeder companies submit, and they had 10 or 15 different cases that all had the exact same language. And the VSRs were, on a clock and working, and they didn't have a mechanism to report that and have some method of accountability for the fraud, potential fraud in the system. So that AI is being used by private companies oftentimes in the disability compensation process where the VA doesn't have a mechanism to combat that on the ground for the raters that are doing that work. So I just wanted to highlight that as something of concern, but we appreciate being invited to the roundtable and appreciate the committee's
Thank you very much for this comment, Mr. Lyle. I mean, this latest NPR expose on that one claim shark company subjecting veterans to collections, and very much like what you, Mr. Makowitz, described. Where did they get this data? How did they get this information on who actually got paid out these claims? This is very disturbing, and I'm dealing with a legislator in California who's been holding up consumer protection legislation that would protect veterans from this sort of stuff. We'll talk about this later. He says, I still want choice for our veterans. They should be able to choose. But if choosing means that we don't protect our veterans in such a way that they cancel their contract with the claim shark, go to you or the VFW, the American Legion or the VFW, you solved the problem or you successfully get their claim, but then the claim shark is like still billing them and harassing them to pay their bill. That's not a choice for the veteran as far as I'm concerned. But anyway, you wanted to comment, Mr.
Yes, sir. So I've actually met with a lot of these companies over the last several weeks, or several months, I should say, and they're charging exorbitant fees. In fact, one of them told me that they were going to charge 29% interest on a Nexus letter. And what they're doing is that they're using these companies, these companies are using the AI to create Nexus letters that are just, it reads the record, comes out with a letter and says, take this to your doctor, have them sign it, and you can turn it into the VA, and it'll be an automatic grant. Well, how many veterans and how many folks are actually taking it to their doctors and having it signed? Same thing with buddy statements. We're seeing these programs come out that are writing buddy statements for folks saying that they saw incidents out in combat zones and whatnot to corroborate stories when the person that supposedly wrote the statement didn't even know that the statement was written because an AI program wrote it and said that this person was there as well. So the reason I bring these things up is because this is the fraud that we're seeing that needs to be regulated. I know I've seen a couple things come across recently where they're asking for metrics. Folks are asking for statistics on how accurate AI is. Well, we all know that statistics can be finagled whichever way you want. And if you're asking folks who designed the programs to give us the statistics, they're going to give us the stats that they want to give us rather than the stats that we need. So one of the things that we are really pushing for is specific requests in metrics data gathering. That way we're actually getting the information that we need. And then also just the mindset that AI is a tool, not an employee. That's something really big because a lot of our veterans are afraid that a computer is going to be generating their decision and they're not going to be able to appeal it. It's like that movie Idiocracy. Everything is done for you through the computer. We need to get away from that and remember that this is a tool, not an employee. So once again, thank you very much for inviting us and appreciate it.
Thank you, Chris. Alex, you want to briefly say something?
Yeah, a couple ideas. I'm going to be as quick as I possibly can. First off, I've been around healthcare and health IT for about 10 years, and there's always a flavor of the month. It's wearables, it's blockchain, it's AI. There's always some widget that's going to come in and save the day. It's never actually the case. Unusual thing about healthcare is a lack of consequences in a lot of different places. So when we talk about trust, when we talk about security of data, we had that huge breach last year, and that company estimates, their own estimate is that they lost $2.45 billion off that breach. Their total profits for the year were $14 billion. So that lack of consequences, speaking as a crash investigator, when you have that lack of consequences, you're going to see something like that happen again. Only other point is we're not getting the data on a lot of veterans that don't make it in the door. And Ranking Member Budzinski asked the right questions in September about potential data breaches. I've been in units where we had a crash. I've been in units where we had a military family member commit suicide, and it all gets swept under the rug because when you're active duty, you have to maintain a security clearance. You have to maintain the ability to get in the cockpit. And so there are a lot of things that people don't talk to healthcare providers about, and they carry that over when they leave the service. The idea that these massive data breaches can happen, that even after you've left active duty, you talk about some of the most private elements of your personal life, and that can get breached out into anywhere to who knows where, is something that keeps people from seeking the care that they need. So it's very important as we look at these kinds of veteran data privacy issues that there are consequences when a breach occurs. Thank you.
Consequences. All right. Thank you so much for your attendance. And I want to thank the members who appeared today. And I think each of us comes away with, a wealth of ideas that we need to start working on. Ms. Brownlee, you want to say anything before we go? All I can say is thank you very much, and hopefully we continue this conversation. Thank you.